pharmacy program that have not been reported to the state system or to the CDC administered here in our state. These doses counted against us in the number of shipped vaccine doses, but did not count in the number of those administered. This statistic, including doses administered per 100,000 residents, is one of the top metrics the media has focused on in the last couple of weeks. We have confirmed with the CDC and the White House coronavirus team that the doses were administered, but that they were not reported as administered here in our state. As of today, we're still working with the CDC to identify the exact number of doses this applies to. Until we know that data point, we do not have a full understanding of how badly this issue has affected Georgia when the media compared us to other states. We are working with our partners at the CDC to rectify it as soon as possible, and we hope it will be resolved by the end of the month. Even with at least 250,000 doses that aren't being credited to Georgia, we continue to beat the national average in vaccinating the most vulnerable to COVID-19. As of today, we are nearing 1 million seniors having received at least one dose, or 70% of our over 65 population. The national average is 64%, according to the CDC data. As a reminder, Georgians over the age of 65 account for 77% of our deaths due to COVID-19. This targeted approach to protect our seniors is saving lives. The media and those playing pandemic politics will continue to focus on whichever statistic of the day paints Georgia in a bad light. But I will tell you, I'm not worried about politics. I'm worried about following the science and the data about who is most vulnerable to transmission, severe illness, hospitalization, or even death at the hands of COVID-19, and ensuring that these individuals have access to the vaccination program. Those are our seniors, those with high-risk health conditions, our frontline medical staff, and our first responders. To remind everyone, our current eligibility accounts for categories of Georgians who represent 92% of COVID-19 fatalities in our state. And it is clear from nearly every COVID-19 data point, cases, hospitalizations, and percent positive tests, that our targeted approach to vaccinate those populations is paying off. The state continues to receive reports of providers holding doses for a variety of different reasons, including to ensure they have enough second doses on hand for those appointments. Given the drastically increased supply of vaccines from the federal government, providers should be getting those shots administered as quickly as possible. That's why my office, in conjunction with the Department of Public Health, today is sending a letter to every provider who signed up to receive vaccines from the state. We expect providers to be utilizing no less than 80% of their weekly allocation of first doses within 7 days of receiving those doses, and also reporting administration to the state within 24 hours. Again, the Biden administration continues to provide consistent vaccine distribution information to the state, so there's no reason for providers to withhold doses. Moving forward, we'll be prioritizing future allocation of doses to providers based on provider inventory, effective distribution, and partnerships with local community organizations in future allocations of doses out to those providers. This week, the state received 458,000 vaccines for both first and second doses, and that includes 11,500 of the Johnson & Johnson vaccine. We expect next week to either be the same allocation or potentially a small increase. However, we are planning for a large increase in supply from the Biden administration beginning the week of March 29th, especially in the Johnson & Johnson vaccine. And finally, we're encouraging every eligible Georgian to please make their appointment as soon as possible. The demand for vaccine is significantly lower south of the Columbus, Macon, Augusta line than it is in metro Atlanta and much of North Georgia. The state has and will continue to reallocate doses to meet the differences in demand we are seeing geographically. Working with Chief Justice Harold Melton and the Department of Public Health, we'll also be adding judges and courtroom staff to the list of eligible Georgians for vaccination that will be effective today. Given the significant case backlog our courts are experiencing, we believe it is vital to get the third branch of state government back operating smoothly and safely. We will be moving quickly, as I've said in press conferences before, over the next couple of weeks to expand criteria in order to ensure we don't have vaccines sitting on the shelf or in a freezer somewhere. If you are over the age of 55, you are eligible. If you have a high-risk health condition like asthma, obesity, heart disease, or any of those currently listed on the Department of Public Health's website, I want to encourage you to schedule your appointment today. Vaccination is our ticket, as you well know, back to normalcy. The more people who are vaccinated, the more lives we save, and the quicker we can all get back to our normal way of life. Over the next couple of weeks, the First Lady and I will be getting vaccinated, and I want to encourage all Georgians to do the same. I'll now turn it over to Director Stallings for a brief update. Director Stallings.
Thank you, Governor, Ms. Marty, Dr. Toomey. Quick update is obviously our 4 sites that we already have up and running are still conducting vaccination today, but we also are happy to report that tomorrow we will begin at our new 5 sites. They're ready to begin because of the work that we have done along with Georgia National Guard, Department of Transportation, Gulfstream Aerospace, many other public and private partners, and most definitely the Department of Public Health. We're excited to be vaccinating more Georgians. To date, or as of noon today, we've done 56,420 first doses and 5,820 second doses. So we're extremely excited about that. By the end of next week, we will have done an additional 34,700 plus first doses, and we'll be more into our second doses, hitting around 24,000 people. Something that we do want to bring up that's very important is that we've stressed since the beginning that our sites are appointment only. And we get that some folks on the first few days traveled to Albany and some of the other sites to get their first dose, and they decided they didn't want to travel that far for their second dose this week. So they've started just showing up, and it's important. Yesterday we had close to 400 people show up with no appointment at our site. So it makes it very difficult if you don't have an appointment, makes the allocation process a lot more difficult. So please make sure you have an appointment. We were able to handle those because of some offsets where we had moved allocation, where the Albany site was not producing what it should have been, so we kind of had an idea that that might happen, but we were able to go there. But please make sure you have an appointment. The great thing about the Pfizer vaccine that we're doing is you have 21 to 42 days to get your second dose. So if you don't get an appointment exactly on the 21st day, it's all right, because if you weren't willing to drive, someone else, you might have taken an appointment that someone else was expecting to get. So make sure you do that. Secondly, we want to make sure we hit that if you're under the age of 18 and you come to one of our sites, please have a parent or guardian with you to get your vaccine. You're required to fill out the eligibility and parental consent forms, so you need to have those with you. As the governor said, we know the keys to beating this virus are a combination of vaccination, hand washing, social distancing, and wearing masks. And for us, we are doing our part. We're excited to be a part of the team, along with Dr. Toomey. And once again, I just want to make sure if you go to My Vaccine Georgia, you're only going to come to our 9 sites starting tomorrow. There are also appointments, and Dr. Toomey will probably hit on it here in just a moment, that are available at public health sites. Just make sure at both of these locations, if they're asking for an appointment, you make it. That's something we are bumping into. So if you'll get those appointments, it can ensure that we'll get you through efficiently. Yesterday, we're proud to say that even with over 400 extras, about the longest wait was 30 minutes. So we're still pretty excited about our efficiency. That's all I got, Governor.
All right, thanks, Director. Dr. Toomey.
Thank you, Governor. I just wanted to hit on a couple of high points that we've talked about before, but I think are worth repeating. One is, if you look on the DPH website, dph.georgia.gov, you can see all this. You can click on a link that talks about all the sites where they are currently have vaccine, as well as how to schedule at our many sites throughout the state, as well as the private sector sites, such as Walgreens, Publix, Walmart's, Kroger, Ingles. And we looked at this availability, and with the additional availability now, with the GEMA sites coming on board tomorrow, there's a lot of availability now. And it's just so important to be vaccinated. As the governor said, this is going to be our freedom in Georgia, to be able to get back to the Georgia we want to be. And I think if you look at the cases in nursing homes, long-term care facilities, that really tells a story of what we can expect for the state as a whole. If you remember, every press conference we had, I talked about outbreaks, and the leading site for outbreaks in the state had been previously in long-term care facilities. And this week, when I checked, there weren't any outbreaks in long-term care facilities, and that reflects the fact that the majority of those long-term care facility residents are now vaccinated. And I think that is what our goal for the state as a whole. And that is how we're going to stop transmission. So I really urge you all to make your appointments when you're eligible, and we can move ahead as a state. We are seeing our positivity rate go down significantly to about 5%. And this is a good sign. We would like to keep it down and keep it declining in the weeks ahead. And everybody being vaccinated will allow that to happen. We are vaccinating, as you know, individuals with health conditions from 16 years old into adulthood, and we recognize that these individuals with multiple health conditions may have a higher risk of having complications if they acquire COVID. And one of the many groups, including asthma, cancer, COPD, those with obesity, those with diabetes, as well as those with weakened immune systems, are all eligible for vaccination now. And I've gotten many calls and many concerns that individuals with lupus or individuals with rheumatoid arthritis weren't specifically mentioned. But because those conditions often are treated with medication that may lead to some immunosuppression, they too are also eligible during this time. So please be sure to let your friends and family know if they have lupus, if they have rheumatoid arthritis, or any condition that may lead to a diminished immune system, then please be vaccinated at this time. We're continuing to work with a lot of partnerships, both for the elder community, ensuring that they have transportation to sites for vaccination, as well as those individuals with developmental disabilities, and also working on ways to transport these individuals who may not otherwise have a way to get to the vaccination sites, including our partnerships with Walgreens that we'll be rolling out next week. I'm also very pleased to say that we've been able to identify at least 3,000 individuals statewide who are homebound and therefore would not have been able to be vaccinated at one of our sites. And we are working out through our public health departments and other partners in the community, vaccinating those homebound individuals throughout the state in the days ahead. And so that's I think, an important opportunity as well for those individuals likely at very high risk for acquiring COVID if they were exposed. And also as an example of how we're trying to work with all of the communities at risk for COVID, I wanted to say that my partner up here, David, and I filmed a video that should be on our website now or will be shortly, as well as the governor's website, with information about the vaccination and how to get it and what to expect with the vaccination, so that everyone, regardless of their abilities to hear or read, can get that information. So that's all I had for today, and thank you very much. No, I didn't. No, I also wanted to mention that our Equity Council met last week. It was a very, very lively meeting. We have 16 members from all over the state, representing many communities of color. And I think what was the exciting thing about that meeting is that there were 16 members, all with 16 different new creative ideas about how we can reach communities, how we can use their influence and their leadership in the community to set up special testing events, how we can begin to get people more comfortable with the vaccines and what they can provide, the freedoms, as it were, that they can provide. And we are actually going to be setting aside some vaccine to ensure that we can work together with the council for some of these special testing events. For example, last weekend in Gainesville, one of our members, Norma Hernandez, was able to do a very special event, and she got over 1,100 individuals in that community to come to that special pop-up site. And it's that kind of event that we're looking to do in special communities, those where there's some hesitancy or some inability to come to our established test sites, and can make it easier to get the vaccine for them. So we're going to be continuing meeting every several weeks, and we'll be using those ideas to help us get additional opportunities to vaccinate in hard-to-reach communities throughout the state.
Well, thank you, Director Stallings and Dr. Toomey. Just before we open it up to questions real quick, I just wanted to remind everyone, especially the media markets outside of the metro Atlanta area, with these additional sites that we have opening up tomorrow, we'll have 9 state sites. We have a lot of availability in that Augusta, Macon, Columbus, south of the line. Please push that out there. Encourage your local citizens and local communities to sign up, to go ahead and get their vaccine. There's a lot of the availability through the federal pharmacy program and other providers in those parts of the state as well. And there's also, quite honestly, vaccine hesitancy in many of those rural communities across the state. And I would urge those Georgians, contact your medical provider, your doctor, your pharmacist, other people. If you have questions about this vaccine, it is safe, it is very effective. I was with Dr. Montgomery Rice from Morehouse School of Medicine last night. We were further talking about her work with Dr. Toomey's team and the educational piece that they're doing, especially in the African American community, to make sure that people are comfortable getting the vaccine. We need to do that in all parts of the state, so I would encourage you to help us spread that word and encourage all Georgians to get their vaccine. Thank you, John.
Governor, do you have an updated timeline based on all your projections of when you might open up the vaccines to everyone in Georgia? You said April perhaps, but...
Okay, you've been watching a live update from Governor Brian Kemp about the state's vaccination efforts. A lot to break down here, so let me go ahead and give you just a few of the highlights. The governor said there is a federal pharmacy commission that has released 250,000 doses here in Georgia. However, those doses that have been administered but not yet recorded, you've heard us reporting that Georgia's still ranking near the bottom when it comes to states vaccinating folks. So it'll be interesting to see once those are added to our overall total to see where we fall then. Nearly 1 million seniors have been vaccinated. That's at least one shot, and that's 70% of Georgians who are 65 and older. And he went on to say that is the group in the state where we've seen the most deaths. So really making some improvement there. The governor wants providers not to hold back any doses for that second dose. You know, we have to do 2 doses with the Pfizer and the Moderna. And he doesn't want providers holding back anything for that second dose because the federal government is getting plenty of doses here to Georgia. And he's sending a letter to that effect. He wants the doses, at least 80% of them, to be used each week. And they're going to start vaccinating, this is today, including judges and courtroom staff because they want to try to get the judicial part of our state rolling again. So that's exciting news. Chris Stallings with GEMA says make sure that you are making your appointment. You just can't show up at these GEMA sites. That's not a smart idea. And Dr. Kathleen Toomey said that the positivity rate is going down, which is great news for the state, but she's encouraging everyone that's eligible to go ahead and make your appointment. And of course, starting this week, that is people who are 55 and older and folks who have certain medical conditions. You can go to the Department of Health website to find out what those are. So much more information. We're going to have so much more later for you. So we're going to bring you the latest information tonight on 13 WMAZ at 5 and 6 and on 13WMAZ.com.
We are the pinkest party on earth.
We are back with the former First Lady, Michelle.